People's lives are moving at a fast pace. It's important to take the time to teach children good oral health care habits that will benefit them for the rest of their lives. For children ages 6 to 12, these years are a time of transition. As children develop, their jaw, face, and teeth continue to change. Young children have 20 baby or primary teeth, and adults have 32 adult or permanent teeth. The transition from baby to adult teeth is gradual. As the jaw grows, it makes space for the additional 12 teeth. Around age 6, many children begin to lose their top and bottom front teeth. Over the next 6 years, the permanent teeth will gradually replace all the primary teeth. Among the extra permanent teeth that don't replace any existing primary teeth are the molars. Between 5 and 6, molars typically begin to erupt, which gave them the nickname 6-year molars. Molars are important adult teeth that are sometimes mistaken for baby teeth. Since they are permanent, they must be taken care of properly to help them last throughout your child's life. 6-year molars are especially important because they help support the shape of the lower face and the position and health of other permanent teeth. You can help your child maintain a healthy smile by scheduling regular dental visits. During each visit, your dentist will examine your child's mouth for tooth decay and will check how the teeth are developing. How often children visit the dentist depends on their unique needs. Your dentist will suggest a dental schedule based on your child's eating habits, how clean the teeth are kept, past treatment needs, if your child drinks fluoridated water, and your child's medical history. Being proactive about your child's dental care can save money and reduce the need for further dental treatment. That's why it's important to schedule regular cleanings, fluoride treatments, and dental sealant applications. Parents and caregivers can set a good example by brushing teeth twice daily, flossing once a day, and visiting the dentist regularly. Most children should be able to brush their own teeth by age 6, with supervision until around age 10. Buy child-sized toothbrushes and let children pick the brush. When brushing along the gum line, show your child how to place the toothbrush at a slight angle toward the gums. Then, with short, gentle strokes, move the brush back and forth. Be sure your child cleans all surfaces of the teeth, the outer surfaces, the inner surfaces, and the chewing surfaces. Check that the tongue gets brushed as well. This helps remove bacteria that cause bad breath. Around age 10 or 11, children should be able to floss on their own, but with supervision. Flossing once a day removes plaque between the teeth, where a toothbrush can't reach. Flossing can be difficult to master, so take the time to demonstrate how to gently floss the teeth. Start by breaking off about 18 inches of dental floss. Show your child how to wind most of the floss around one of his or her middle fingers. Then have the child wind the remaining floss around the same finger on the other hand. This finger will take up the floss as it's used. The floss is held tightly between the thumbs and forefingers, with about an inch of floss between them so there is no slack. Now, gently slide the floss between the teeth. When the floss reaches the gum line, curve it into a C shape against each tooth. Then gently slide it into the space between the gum and tooth until you feel resistance. Hold the floss against the tooth and gently rub the side of the tooth, moving the floss away from the gum. Make sure you don't forget to floss the back teeth, since plaque often collects here. If your child hasn't been flossing regularly, the gums may be sore or bleed at first, but this usually stops within about 5 days. A sealant is a thin covering applied to the tooth. Sealants act as barriers to keep out plaque and food and help decrease the risk of tooth decay. Sealants are most often used on chewing surfaces of the back teeth, like the premolars and molars. These are the areas most prone to plaque and tooth decay. Sealants are applied during one dental visit. To help the sealant stick to the tooth, your dentist prepares the chewing surfaces of the tooth. Then the sealant is applied to the tooth enamel. Sealants are very durable and can last for several years before they need to be reapplied. As long as the sealant remains intact, the tooth surface will be protected from decay. Both primary and permanent teeth can benefit from sealants. A bad bite or crowded crooked teeth are often noticeable when a child is between 6 and 12 years old. Sometimes the condition is inherited or could have resulted from an accident. A bad bite could affect a child's eating or speaking. It can also cause teeth to wear down abnormally or to become more easily chipped or fractured. By the time children are 7 years old, they should receive an orthodontic evaluation. The dentist or orthodontist will check your child's bite and determine when any necessary treatment should begin. An early evaluation can help prevent the condition from becoming worse. Another way to help keep a child's smile strong and healthy is by using mouth guards. Mouth guards are a great way to help prevent injury to the mouth. They should be worn when playing contact sports like hockey or football, and also during non-contact activities such as bicycling, rollerblading, skateboarding, or gymnastics. If your child participates in recreational activities, ask your dentist about mouth protectors. What children eat can also affect their teeth. That's because plaque, a sticky film of bacteria, is constantly forming on the teeth. When we eat food or drink beverages that contain sugar, the bacteria produce acids that attack the tooth enamel. To protect your child's teeth from acid attacks and tooth decay, limit in-between meal snacking and avoid sugary foods and drinks. If your child needs a snack between meals, offer nutritious foods and save sweets for mealtime. Fluoride is also an important part of a diet since it's nature's cavity fighter. In most areas, fluoride can be found in your community water supply. If your child drinks bottled water, check the bottle's label to see if fluoride has been added. Good oral hygiene and a nutritious diet are important for children, but you should also talk to your child about the dangers of tobacco use before he or she is tempted by peers. Tobacco, in any form, can become a dangerous habit and cause permanent damage to teeth and gums. It can even cause oral cancer. Practicing good oral health care habits during tooth development is essential to strong teeth. If you have questions about what's right for your child's teeth, just check with your dentist. Regular dental checkups and professional cleanings can help your child have a lifetime of beautiful and healthy smiles.